This is the next case in our case series. And this is an interesting case for a number of reasons, mainly because it helps demonstrate the appearance of different ages of blood products on the same study. And this can be really tricky because you can have patients who have what looks like something chronic going on, but there can always be an acute subcomponent. So first things first, we're going to window our reformats here in kind of a more traditional subdural window so we can get a better look at things. But already as we start looking at this, we notice that there is a large extraaxial collection here that's pushing the parenchyma away. And when we look on the axial as well too, we see it especially on the left side, but actually it's also on the right side, which we'll take a good look at here on the axials, and we'll kind of corroborate everything, but we can see it here on the coronal. But as we look through, what's important to realize is there's clearly a low density component here on the left and even on the right. So there's a low density component here, but there is also a high density component like this right here. And then even on the left side, there's some layering presumed blood products here. And then over here as well too. So the more we look, the more we see that there are low density bilateral frontal collections with high density components. And if you look on the coronal, you can see these high density layering components as well too, there and then here as well too, right there. So long story short, what this looks like and most likely represents is bilateral chronic subdural hematomas that have an acute component. So you don't want to write this off as all being chronic because you see hyperdense blood products. There is acute bleeding here, and it needs to be followed in a similar way because these collections can grow and become clinically more impactful. So at the end of the day, don't write everything off that's low density, and just because part of it is low density doesn't mean that all of it is. So again, window appropriately, look at your reformats. This one is, these are large enough where you can catch it on both the axial and the coronal, but on the coronal you see some of this acute component. Again, it's caught in plane, so we see more of it at one time, and it makes it more promiscuous and conspicuous that there is subdural, acute, maybe subacute blood products here on the left side, and then also on the right. So look at that. So that's all, hyperdense blood.